Hi, I am myself Paul from SNS College of Physiotherapy. Today we can discuss about the stretching. So with my mentees, first we can see about what is stretching and what are mechanism will undergoes within the stretching. So first we can discuss with the anatomy.
Stretching is a physical activity which elongates the muscle or a group of muscles to increase flexibility, to increase range of motion and to decrease the stiffness. The mechanism that undergoes in stretching is stretch reflex, which is also called as myotactic reflex. In that reflex, inside the muscle spindle, also called as myotatic reflex, inside muscle, the muscle fiber's length changes, which sends the signal to the spinal cord. And the spinal cord again receives the signal and sends the signal to the spinal cord, which makes the muscle to contract against the stretch. This is the mechanism that undergoes during stretching. So, importance of this mechanism is which facilitates the movement and increases the flexibility of the muscle.
So now we can discuss about the mechanism. So mechanism mainly stretching will undergoes and done by the stretch reflexes. So it is also called myotonic reflexes. Mainly that agonist muscle will undergoes the stretching and antagonist will be a contraction. So this is the stretch reflex. So next we can see about the types of stretching. So we can discuss with the Mukesh.
Type of stretching, 5 type of stretching. Static stretching, dynamic stretching, balancing stretching, PNF and isometric stretching. Static stretching is involved hold the stretching position for 30 to 60 minutes. This type of stretching to increase the flexibility and aids the recovery of muscles. And this type of static stretching divided into the two types: active stretching, passive stretching. Active stretching is performed to the own muscles and the own joint. Passive stretching to perform to the therapy that hold the patient's hand and perform the stretching position to relieve the pain. Next, dynamic stretching. Dynamic stretching involves the move the joint in full range of motion to facilitate the joint movement and mobility and reduce the pain. Next, PNF techniques. PNF is full form proprioceptive neuromuscular facilitation. This type of techniques mostly used for neuromuscular condition and two diagonal is D1 flexion, D2 extension, D1 extension and D2 flexion. Next, isometric stretching. This type of technique used for isometric means iso same, metric length. Length is same and the tension is changed. This type of technique mostly performed to the sports person. And balancing stretching. Balancing stretching is bouncing and rapid movement and joint perform the beyond the full range of motion.
So types mainly we can see about the static stretching. So static stretching we have a active and passive stretching. So active stretching is also called as self stretching and passive stretching is also called as manual stretching. So these stretching mainly target to along the muscle tissues or muscle length. Next we can say about the indications. What are the indications for the stretching?
Indications of stretching. Number 1, decreased flexibility when muscles and joints become stiff or have limited movements. Number 2, muscle tightness after long sitting or physical or lack of activity. And number 3, before and after exercise to prepare muscles for activity and reduce muscle soreness. Number 4, prevention of injury helps to reduce risk of muscle strain and improve movement. And number 5 is poor posture, current muscle imbalance and improve body alignment. Number 6, rehabilitation helps to restore movement after injury or illness.
So in indications, so indication means which condition can given to the stretching. So mainly muscle tightness, also called as a muscle spasm. So in muscle spasm we have present a pain. So pain due to the So in muscle spasm mainly pain will occur. So that muscle spasm due to the shortening of the muscle fibers. So we can do the stretching and elongation the muscle length. And also we can even do the post-operative contractures. So that will be also help to elongate the muscle fibers. So next we can see about the contraindication of stretching discussed with the Brinda.
Contraindications of stretching: acute muscle or joint injury. It can cause bleeding, swelling, and tissue damage. Fractures or recent bone injuries. It can cause displacement or delay healing. Third, acute inflammation or infection. Example: tendinitis, bursitis. It can worsen the pain and tissue damage. Severe pain during stretching. Joint hypermobility. It can further destabilize the joint. Hematoma. It increase bleeding pressure in the area. Post surgery. Finally, recent stroke and neurological condition. It can cause muscle tone issues, etc. Thank you.
So in contraindication, so mainly any acute condition cannot given the stretching. So due to the shortening or decrease in the
One.
so in contraindication, so mainly any acute injury will not given the stretching. And also neurological condition. So in neurological condition, first stage, acute stage, we can see about muscle tone will be decreased. So that stage will not give the stretching. So today we can see about the what are the stretching and mechanism and also indication, contraindication. Thank you.